Hi, everyone. Thanks for that introduction. So we're going to be talking to you today. Can you figure out how to get to where? So we're going to be talking to you today about why we decided to move to a cloud-based library service. How WMS implementation simplified technical services workflows, best practices for library staff training for one specific WS module, that is circulation. And we're also going to be talking about the development of a new discovery system communication plan for our user community. So let's go ahead and get started. So just a little bit about Levy Library. It's the academic health sciences library of the Icahn School of Medicine at Mount Sinai in New York City, and we support the education, research, and clinical needs of not only Icahn School of Medicine, but the Mount Sinai health system as a whole. And it is a huge system. It's the largest non-government employer in New York City. We have 7 hospital campuses, more than 7,000 physicians, and more than 30 affiliations with community health centers. And we support students, faculty, and staff by providing on and off campus to an extensive collection of resources. So just to give you a little bit of a feel for our collection includes over 70,000 e-journals, 200,000 e-books, 200 databases, and we support our user communities through numerous other avenues. And we do this all with a very lean staff. We currently have 9 librarians across the system and 9 staff members. So I'm going to hand it over to Elsa now so she can talk about our decision to move to WMS.
So hi, this is Elsa. I was on the team that originally selected WMS, and we had a couple of things we were looking for in a new ILS system. Our old ILS was hosted on a local server, but we found that we had varying levels of local IT support for things like server upgrades, upgrades to the software, running reports, and just generally within a medical environment, if you're not running a clinical application, you're not the highest IT priority, and that's totally reasonable. But it meant that we were really looking for a cloud-based system where the library would have control over our own system. Cost was another big factor for us. We try to run fairly lean. So one attractive feature of WMS was that the annual subscription fees were actually lower than our previous ILS license fee, and including implementation, it was about the same. So that was an attractive feature of WMS for us. And another very attractive feature were metrics. So we've had new leadership within the IT department, which we're a part of, new leadership within the library, and all of this has brought intense scrutiny on the library and a need to prove return on investment and that we're doing something useful with the library budget. So our previous ILS had very limited reporting capacity, and getting reports was complicated. We don't have a dedicated systems librarian. We didn't at the time. So any reporting needed to be done by me. And that was something we were really looking for and excited about when we switched to WMS. Another important point, Robin mentioned that we are mostly e-journals and e-books. We are actually a 95% electronic collection. This is a reflection of our user tastes. The medical community was one of the fastest adopters of electronic, and there's a heavy demand for electronic journals particularly, but also e-books, mobile apps, question banks, and just various kinds of e-resources. We're actually probably less than 5% print holdings now. And we found that most of our circulation transactions at this point are really transactions of equipment. We check out headphones, laptops, chargers, that kind of thing. So moving ahead with the implementation, we found that OCLC and WMS provided the implementation checklist and the project plan. I was our local project lead, but OCLC provided us a project leader. We did do a team implementation, so we were one of a cohort of 6 libraries who all implemented together. We're all sort of racing to make a September 1 implementation goal. But OCLC was very helpful about providing the checklists of what had to happen, the timelines, the training materials, assignments that had to be completed by a certain time, which made it easy for me as the project leader to then bring this back and translate this into assignments for specific people at my library. And at the library, we also had an implementation team who met sort of weekly to talk about how we were doing and what needed to focus. And then each area within the library had a project group that we could call on to say, okay, you know, now we're making decisions about circulation, let's talk about circulation policies, or let's talk about how this is going to affect the user, let's talk with reference. We did find that data cleanup was a big issue for us. MARC records, exporting them, but also just discovering what we actually had in our old ILS as a result of probably 20-something years of changing cataloging practice was surprising and made our implementation a little more complex than it needed to be, just because we had a hard time with the MARC records. And our patient account records also were quite messy, which sort of gets into what challenges we face during implementation. The other is just implementation is time-consuming. We now have 9 librarians. At the time we implemented, it was, I think we had 6 or 7. And the time when you are almost ready to go live, but you are not live yet, is a difficult time because you are putting all of this effort and work into your new system, but you still haven't quite cut ties with the old, and that's a confusing time that we found was a little difficult. And staff training was a real issue. You know, we had to train the entire library, and I will say that the technical services staff was amazing about really working very hard, and the CERC was as well, but Robin will speak to that later. So the overall changes for our library, before there was a really very clear delineation. We had an ILS system that had print books in it, and our cataloger handled all the records that were in it. And she had 2 library assistants who supported that effort with print books, print serials, and MARC records. And then I handled the link resolver, all the e-journals, all the e-books, all the KBART records, all the data loads, all the updates was all done by me. And that really wasn't sustainable when you're talking about 95% of the collection being electronic. So after our implementation, we have WorldShare Record Manager, where our cataloger still does, handles all of our cataloging, works on MARC records, works on holdings projects, weedings projects, the original cataloging that needs to get done. But now the WorldCat knowledge base, we really use this as an opportunity to retrain staff into a new area and shift some of our assistants from being primarily print assistants to primarily electronic resources assistants. So now they work, they spend a lot of time working with KBART files, doing file uploads, and working with electronic resources in general. And this reorganization of responsibilities was probably overdue at our library, but doing this implementation was a really good time to stop and take a look at what are our processes, what is our focus, and what do we really need to be doing here. I'm going to hand it back over to Robin to talk about circulation.
Thanks, Elsa. So just a little backstory. I came on board at Levy Library in July of 2014, so right in the midst of the migration, and man, let me tell you, that was a really fun time. I'm partially being facetious, but at the same time completely serious. Migration can be really super stressful because there's a lot of moving parts, but at the same time it's really sort of exhilarating because there's a sense of a fresh start. But anyway, in these initial stages, it was my job to help Elsa with some data migration, but given that my primary duties are in access services, specifically circulation, for the most part I was working on the back end of CERC configuration for WMS and coming up with a training strategy for our CERC staff. So just a little overview of our CERC environment. So we have one CERC desk, no reference desk. There are two circulation kiosks. And when I came on board, I think the average tenure for a CERC staff member was about 16 years. And they have many wonderful qualities, including great customer service skills. Having said that, there were some challenges related to the implementation of WMS at CERC because some of the staff were a little bit reluctant when it came to change, especially new technologies, and that wasn't even necessarily not being confident with new technologies. It was more just coming from a feeling of, oh, like another ILS. We've been through how many of these, like how long is this going to last? That sort of skepticism that comes with having been around a long time and seeing new technologies come and go and fall by the wayside. And there was also some doubt on the part of CERC staff in terms of a cloud-based system, like just this sort of lingering idea that it maybe wasn't as stable or reliable or dependent as a client. So having said all that, these are some sort of best practices that emerged largely through trial and error with training CERC staff members on WMS. So the first is that I found it really helpful to explain to the CERC staff that they're probably using cloud-based technology somewhere in their lives already, like a web-based mail client, like Gmail, or a photo sharing site like iPhoto. So it was helpful to create an analogy between the convenience of a cloud-based service used in their own lives and WMS. Next, you definitely want to demonstrate the advantages of a cloud-based technology by getting out from behind the desk. So I showed, or tried to show the CERC staff that a cloud-based system could really free us from the CERC desk. So for example, as also mentioned, we check out a lot of equipment, like laptops, for things like instructional purposes. And it can be really difficult to complete this task at the desk because there's constant interruption. So WMS would allow CERC staff members to take the laptops like on a cart or just move to a more quiet area using a laptop to complete the checkouts. This isn't on here, it might be on the next slide, but I also just want to say checklist, checklist, checklist. It's very important to create checklists of all aspects of CERC functions that you need to train CERC staff on, and definitely get their input. See if there's anything that they feel you've left out, and be sure to work then systematically through the checklist. And it's helpful to try to involve CERC staff in the training as much as possible. I think training someone on a new technology needs to be really interactive and hands-on. So it can be helpful to kind of take a flipped classroom approach, which is very in vogue now in instructional design circles, but it's basically you can just train one CERC staff member on one aspect of WMS circulation, like placing holds, and then allow that person to train their fellow CERC staff members. They're just studies have shown that people are sort of more likely to retain information when they're teaching it rather than just passively receiving it. And this is sort of more of just like a general best practice, but just be prepared to devote a lot of time up front. As Elsa said, it's, this is a time-consuming process from start to finish. And understand that it's not just a new workflow, but it's really a new concept. It's cloud versus client. And so just make sure you allow a lot of training time on the front end. It will definitely pay dividends over time. And remember to let OCLC do the work for you. They have a lot of great training materials available, especially videos, so be sure to take advantage of those, but sort of personalize them so they're relevant to your staff. And just remember the burden of proof is on you. It's really up to you to explain why the transition to WMS is beneficial to your library, not just for your users, but for your CERC staff members as well. You want to talk about how this is going to make their lives easier and better. Okay, so kind of switching gears here, talking about a communication plan for our user community. So we found that it was really best to sort of hone in on two key aspects of WMS to emphasize, and this was really critical amongst the medical community, who we know are incredibly busy and overwhelmed with information. And those two key qualities were the speed and ease of using WMS. So you want to talk about how it's going to make finding items faster, renewing items easier. So for example, we emphasize the following points in our communications. We said things like, it's a streamlined Google-like search for books, ebooks, and journals, right? That's something very palatable and just quick and short, something busy doctors can digest easily and understand. We also said it's a one-stop shop for searching across the library collection. So in terms of communication methods, remember that you'll need to select appropriate communication channels to reach your various target audience. That's, of course, just kind of communication 101. We made an effort to ask people outside the library to review all our communications to make sure they were sort of accessible to a non-library audience, because as librarians, it can be really easier for us to sort of slip into jargon. And going back to planning and allotting adequate time, you're just going to make your life a lot easier if you start planning early. Your communication plan shouldn't be something you tack on at the end of your implementation. It's something that needs to be integrated. You'll have points in the implementation that are, I would say, a little bit tedious. I don't know if I also would categorize them as the same way, like data validation. So taking a break to work on your communication plan is sort of a great way to break that up. And then you want to always be prepared as well for negative feedback, and just, you know, don't let you get that down. Some people are just reluctant to change in any form, but make sure you keep that feedback and organize it so then you can assess it and respond as necessary. So these were some of the communication channels that we used to share information about the transition to WMS. So we created several LibGuides that really served as user guides for the new patron-facing interfaces, like their library accounts and the new catalog search. We made sure to include a lot of screenshots and basic instructions. We included spotlights on other areas of our website, that we knew users would visit frequently, like the e-journals page. We sent out a broadcast notification, which is like our mass email system, and I know emails can get lost in the shuffle, but it's really critical because it's a way to hit everyone at once. And we, of course, made sure to promote WMS on all our social media platforms, Facebook, Twitter, our blog. We created old school print flyers and put them in strategic areas like at the CERC desk and the public computers. And we also made sure to get on the agenda at a number of community meetings, like the faculty council and student council meetings. And getting on the agenda for these meetings is part of the reason getting stakeholder buy-in from your leadership is really important, because you're going to need their help with getting the ear of these outside groups. So on this slide you'll see, or I'm sorry, it's on this slide here. I guess we didn't include it, but we had we created a handout for the faculty council meeting, and we included a before and after version of the patron interface, just to give them a visual of how sort of improved the search was. And I would definitely recommend including little before and afters like that, and making things sort of as graphical as possible for your users. So I'm going to pass it back over to Elsa just to kind of do a general overview of how things were and how things are now.
Thanks, Robin. Well, so some of the things that we've found are that our workflows have changed significantly, where the whole department is now involved in electronic resources management, which is a real improvement for me, speaking as the staff member who was doing it by themselves before. And we find that there's a real improvement with metrics. In our old system, it would sometimes take several days to run a report to get it to be exactly the right criteria. There was no way to export into Excel. But now I do find that most of the reports I need, I can run it quickly and export it into a spreadsheet. And, you know, there isn't always everything I need. Nothing's perfect. But it's nice to have that functionality and to not have to try to convert text files into spreadsheets. And we think with the user experience that it has really been a good change as well.
Yeah, it's definitely gone from being sort of a librarian-friendly interface to a more streamlined patron-friendly interface. And we are now, of course, one of the greatest and most freeing benefits is that we can search across multiple collections, and our users really, really love that.